The book, Canadian Century, actually told the story of the great budget reforms of the Chrétien-Martin era, when Paul Martin was the finance minister, Jean Chrétien was the prime minister, and the two of them together understood that Canada had taken a wrong turning somewhere in the 60s, 70s, 80s. The Wall Street Journal said we were an honorary third world country, which was one of the things that stung the government of the day into action. And result of the reforms was we saw in Canada the largest reduction in the size of government of any Western society in the post-war years. It was really an unbelievably rapid and profound change of course for Canada. We balanced the budget, we cut taxes.
Concepts with Shawn.
I'm delighted to have Dr. Brian Lee Crowley with us today. Dr. Crowley is the founder and executive director of the award-winning Macdonald Laurier Institute, a public policy think tank in Ottawa. He's published 6 books. We'll be talking about 3 of them here today. He's worked as a visiting economist with the Canadian Federal Department of Finance. He founded the Atlantic Institute for Market Studies in '94. He served on the board of directors for the Globe and Mail. He's been a professor. He wrote his doctoral thesis on Friedrich Hayek's social and political philosophy. And most recently, he just established the Center for North American Prosperity and Security, I believe just last year. So I think he has a crystal ball into geopolitics. Welcome, Dr. Crowley.
It's so great to be here with you, Shawn, and I'm a great admirer of your work on healthcare policy, amongst other things. I consider it a great honor to be on your podcast.
Thank you very much. So I wanted to start with your latest book, and it's called Gardeners versus Designers, Understanding the Great Fault Line in Canadian Politics. Over the last 2 weeks or so, I've been asking people, in light of looming elections in Canada, what does the word conservative mean in Canadian politics? And you open this book with an answer, a kind of an answer to that question by saying maybe that's the wrong question to be asking. And this is Dr. Crowley, quote, "We fatally misunderstand our politics in Canada if we think that the main divide is between the principal political parties, Grits versus Tories, say, or progressives versus reactionaries, as the left would like to frame it. Having misconceived the nature of what divides us politically, we then profess to find ourselves disappointed by the shallow nature of the political debate that results." End quote. Explain.
The title of the book, Gardeners versus Designers, is intended to capture 2 different ways of thinking about the role of government. And that's why I said that this was the real fault line in Canadian politics, but that because we don't really grasp this fault line, the fault line actually runs through the political parties rather than separating the political parties. And what I had in mind was I always think it's good to proceed by concrete example. Let's say, let's talk about access to prescription drugs. This is something that a lot of people care about. It's become a bit of a political issue. We know that the federal government has said that they want to have a national pharmacare program kind of modeled on Medicare. And so there's been a lot of debate about, okay, is that a good use of public money and so on? But not enough people are talking about what the alternative is and what this pharmacare would replace. Because actually we have a system in Canada that's grown up over time through experimentation, interaction between governments and insurers and employers and ordinary employees. And this system, which nobody designed, which kind of grew up out of experimentation, trial and error, actually serves the vast majority of the Canadian population extremely well. The vast majority of Canadians have perfectly fine access to prescription drugs. It is quite accurate to say that there is a very small share of the Canadian population that doesn't enjoy that access. And that's a problem that we need to solve. But the left answer is to sweep away this entire edifice of that has been created through history and experimentation, negotiation between those different parties that I mentioned, and which serves the interests of the vast majority of Canadians. Since it doesn't serve some tiny share, we need to get rid of the whole thing and we're going to replace it with a single government monopoly, untried, not based on historical experience and tried and true experience of everyday Canadian. And this is what I'm trying to get at when I contrast gardeners and designers. The first system, the one that serves the vast majority of Canadians very well, was not designed by anybody. It grew up through this process of trial and error and experimentation that I've talked about. Works extremely well. The alternative that the government's proposing to put in its place is one based on the idea that we hate patchwork. We hate anything in which one person gets something that other people don't get. And if we are to solve the problem of uninsured Canadians, this small share of the population that doesn't have proper access to drugs, we have to create a single system and design it for everybody. And my experience is that when we sweep away these institutions that have grown up through experience and trial and error and replace them with some design system that some bureaucrat somewhere has sat down and said, if I was starting from scratch, this is the way I would do it, almost invariably results in higher costs, lower levels of service, less satisfaction, et cetera, et cetera. I was trying to get at the idea that actually human societies are quite good at evolving, at growing institutions that serve the needs of people. And that when they are allowed to do this, when they are allowed the freedom, this kind of trial and error, experimentation, and negotiation that I talked about in the system for access to prescription drugs. But we could talk about all kinds of other things. We could talk about financial institutions. We could talk about many things that grew up out of a long historical period of trial and error and experimentation. When we replace them with these design systems that bureaucrats think appeal to them because they're uniform and treat everybody the same, we degrade the quality of our institution. We degrade the quality of life that Canadians enjoy.
Brilliant answer. Thank you, Dr. Crowley. That seems to tie directly into the next book I'd like to highlight. And you co-authored this book in 2010. It's called The Canadian Century, Moving Out of America's Shadow. And it seems to have particular relevance to what's going on today. I want to read two brief quotes. You and your co-authors start out by highlighting Sir Wilfrid Laurier's vision. And he is a very famous Canadian Prime Minister. He said, quote, "We are a free and happy people, and we are owing to the liberal institutions by which we are governed." He explains freedom as, quote, "freedom in every sense of the term, freedom of speech, freedom of action, freedom in religion and civil life, and last but not least, freedom in commercial life," end quote. And then you end the book by saying, quote, "When Canada follows the master plan that Laurier envisaged, its people prosper, and it is a magnet for the best that the world has to offer." And then jumping ahead, paraphrasing a bit, you said both Canada and the U.S. followed Laurier's plan after World War II, open societies, welcoming investment, keeping tax burden light, rewarding work and savings, and so on. However, in the 60s, quote, "Canada began a 20-year love affair with an aggressively expanding state, turning an increasingly deaf ear to the entreaties of those who still hewed to Laurier's line," end quote. And you and your co-authors end with a hopeful call to action to say there's still time to recapture Laurier's vision, and we actually might turn out to be the high performer in North America. Would you say the same thing today? And have we achieved your call for coming out of America's shadow?
Boy, there's a whole pile of questions. Let me start with the book, Canadian Century. I actually told the story of the great budget reforms of the Chrétien-Martin era, when Paul Martin was the finance minister, Jean Chrétien was the prime minister, and the two of them together, I understood that Canada had taken a wrong turning somewhere in the 60s, 70s, 80s. We'd allowed this restricted, unintended vast expansion of the size of the state, the rise in the tax burden, which was accompanied by a huge expansion of the civil service, et cetera, et cetera. And we discovered that because Canadians were not willing to pay the taxes that would have allowed that expansion of the state to be paid for out of income every year, governments got into a lot of borrowing. And we actually got to the point where pretty much every new dollar in taxation went straight to paying the interest on the debt. And we were in a kind of a death spiral. The Wall Street Journal said we were an honorary third world country, which was one of the things that stung the government of the day into action. And result of the reforms was we saw in Canada the largest reduction in the size of government of any Western society in the post-war years. It was really an unbelievably rapid and profound change of course for Canada. We balanced the budget, we cut taxes, reduced the size of government, and all those people who said, but this is terrible, it's an attack on everything that makes Canada a great society, enlarged government is what makes society successful and brings about equity and all these things. And in fact, what we discovered in the decade following the success of the Martin budget reforms was that it was exactly the opposite. We outperformed all the other G7 countries in terms of economic growth. We were the only country, we had a decade of balanced budgets, et cetera, et cetera, et cetera. And most interestingly, as a result of these reforms, we saw poverty in Canada take a big nosedive. The number of people living on low incomes fell very significantly. The idea that only enlarged government could help, say, the poor, would help raise them up, give them more opportunity, et cetera, it turned out to be the exact opposite of the truth. That the Laurier plan, which was to keep taxes low, keep government out of the way, give people lots of room to exercise their energy and their enthusiasm and their entrepreneurship and so on, ultimately resulted in not only a richer society, but a fairer society. Now, you asked me, did we continue to be an outperformer? And the answer is no, because we, again, somehow took a wrong turning. I don't know, the exit was not correctly marked off the old highway, and government got back on this expansionist course under both conservatives and liberals, although to give Harper and his government credit, they got knocked off course by the 2008-2009 financial crisis. And they did what government is supposed to do in those crises, which is to increase spending to sort of tide people over so the economy doesn't collapse. But the result was, there had to be a lot of borrowing. That's by definition how it worked. And they were pretty disciplined at moving back to budget balance. And they almost got there by the time that they were defeated in the 2015 election. And then you might remember that Justin Trudeau and the Liberals broke what had been then a cross-party consensus that budget balance was where we wanted to be. And budget balance is an important anchor. It's a discipline on government. What it means is governments are then constrained to spend only what Canadians are willing to grant them in terms of taxes. If you break that rule and allow them to borrow, they're able to push the cost of their decisions off into the future. And people get the benefit of the increased public services right away, if you think that's a benefit. Anyway, let's say that it is. You get all these increased benefits and checks and all sorts of things from government, but you don't see an increase in your tax burden. And you say, hey, government's doing good things for me. And the thing is that the chickens always come home to roost. And we have gone through a period in the last decade where America's economic growth has just taken off like nobody's business. Their productivity is up, their individual incomes are up, et cetera, and Canada has just stagnated. The response to your question is Canada has not been the outperformer that my co-authors and I hoped that it would be. It was the North American outperformer during that period when we pursued Laurier's prescription for Canada. As soon as we abandoned that course in a sustained way, not in response to a crisis, but as a general governing principle of Canada, that we can expand the size of government and somehow the budget will magically balance itself, and we don't, expanding the size of government is always to the benefit of Canadians. As soon as we fell back into that trap, we fell back into the low productivity, social performance, and all the other things that go with this kind of decorum.
Yeah, great answer. Picking up on your comments about the chickens come home to roost, and when our general governing principles come to fruition, I want to pivot slightly and get your thoughts on how government reforms shape the citizenry. Is the population, are Canadians shaped by what our leaders do? And I want to read Fearful Symmetry, The Fall and Rise of Canada's Founding Values from 2013. And I believe this is the last chapter of your book. And I think these few sentences here are just brilliant, but I wanted you to explain them in light of what we've just talked about. Quote, "What do governments have to do with the character of the people who live under them? Some think that the character of individuals is simply given, that it is beyond the reach of governments and policy. Anyone who has seen the effects of decades of Eastern European communism on individual behavior, or the damage done to individual behavior by lawless, corrupt, and arbitrary regimes, such as Zimbabwe's or Nigeria's or Pakistan's, will know that there is an unbroken continuum between individual behavior and the institutions under which one lives. Under some regimes, it is quite impossible to live honestly and honorably. In others, good behavior is simply discouraged or not rewarded. And in still others, formal and informal institutions serve to support and reward honesty, thrift, self-reliance, and independence of mind. That is why some writers have even spoken of statecraft as soulcraft." End quote.
Boy, I wish I'd said that.
It's brilliant. It's brilliant. I love it.
Again, I always think it's good to proceed by practical examples. If you live in a society in which most people work for the government, as opposed to the private sector, let's think for a second about the impact that might have on your life. First of all, if the vast majority of people work for the government, okay, you're all unionized. The public sector trade unions are very powerful. It's almost impossible to get fired. You don't need to offer goods and services to people in the hopes that they will voluntarily, with their money, in order to purchase those goods and services. You are in a position where you can compel people to give you the money that you think is necessary in order to carry out the programs that you've been given. So in many ways, the experience of people living in a society in which government is the principal employer, and don't forget that this includes teachers and healthcare workers in Canada, all of these people work for the state. That's going to produce a very different set of attitudes towards economic risk, entrepreneurship, the relationship between people who produce goods and services and people who buy them. You don't have a commercial society, one in which the predominant experience of people working in the private sector is one in which you cannot force people to give you their money. You must give them something that they value in order to get their money. And if the economy goes into a downturn, you might lose your job, regardless of whether you got trade union protection or not, because this is part of the risk of living in a society in which people are free rather than one where people have to respond to compulsion. So that's just one small example of ways in which the balance of institutions in society between, in this case, the public sector and the private sector would affect the way that people think about the proper way that our institutions operate. If you've never had experience of the private sector, you wouldn't know anything about these. You'd think, when we decide through some democratic process that some service will be provided, we are authorized then to take the money for it. And the idea that the provision of services, the quality of institutions, and so on, is a negotiation between people some of whom want to provide the service or the good, and the people who are the intended audience. In the private sector, there has to be a negotiation. There has to be an exchange of value. None of that happens in a society dominated by government services and government workers. Or think about a society in which the military is allowed to atrophy, and there are few people who think about the difficulty of defending our society against people who might wish to do us harm, or who would like to take the things that we have that we value that other people would, rather than making them for themselves, would like to take away from us. And we think about the values of honor and courage and so on, fortitude, that characterize the military, and the fact that in one kind of society, you might have a military base near almost every major community, and there would be defense suppliers, and there would be people who had served in the military and now retired, living in communities all across the country. A society which takes its national defense seriously would have a slightly different balance of value in the society as a whole. So there's just two examples off the top of my head of the ways in which governments can affect the thinking of the population by giving people different kinds of experiences. And that's, I think, just a practical way of illustrating this idea that statecraft is soulcraft, that you, by the way that government thinks about people, and it thinks about who's in charge. Is it ordinary people? Are they in charge of their lives? Is it the government that's in charge of their lives? Who's minding the store to make sure that bad people don't steal the things that we worked hard to create? All of these things have powerful incremental effects on how we think about ourselves, our society, the role of government, our responsibility for self, et cetera, et cetera.
Yeah, great answer. And when you mentioned the military, I have to share this, one of my favorite quotes from Winston Churchill. In fact, I have it printed out and stuck to my my wall behind my computer, and I'm going to read it to you here now. This is Winston Churchill in 1905 speaking about the Army. Quote, "The Army is not a limited liability company to be reconstructed, remodeled, liquidated, and refloated from week to week as the money market fluctuates. It is not an inanimate thing like a house to be pulled down or enlarged or structurally altered at the caprice of the tenant or the owner. It is a living thing. If it is bullied, it sulks. If it is unhappy, it pines. If it is harried, it gets feverish. If it is sufficiently disturbed, it will wither and dwindle and almost die. And when it comes to this serious condition, it is only to be revived by lots of time and lots of money." So that's my Churchill quote. But back to Crowley quotes, I have to read back in Gardeners versus Designers. And we're connecting back to the mindset of the citizenry and how we view society and we view institutions such as the military or education system. This is from your introduction, and Dr. Crowley says this, quote, "The gardener's mindset is guided not by a central idea or policy, but by two emotional dispositions. They are first and foremost grateful for what we as a society have. One might even say that we love the peculiar and unique institutions, history, experiences, and behaviors that constitute Canada, because all of these have made us who we are," in italics. Second, gardeners are humble about the ability of present-day men and women to substitute their own necessarily limited knowledge and experience for that embodied in the institutions, traditions, and culture of which we are the inheritors. End quote. Your comment.
Well, you just read my comment. Yeah, I know you're quite interested, Shawn, in conservatism is, especially in the Canadian context. The quotation you just read was my attempt to summarize what I think conservatism is in the Canadian context, but it's helpful to contrast that with the alternative, because my view is that if conservatives are grateful, and grateful because we understand that the default condition of humanity is not peace and prosperity and good health and all these other things. On the contrary, the default condition of humanity is poverty, disease, and ignorance. And it's only a handful of societies in the world that have managed to escape those conditions. And the ones who have managed to escape those conditions most successfully have some very important things in common. They're Western, democratic, free societies. And so we're grateful for these things and very mindful of the fact that the prosperity and the good health and all the other good things that we enjoy are not something that are just given to us. They're not the default condition of humanity. What is simply given to us is this disease and squalor and poverty. And it takes a tremendous amount of hard work to escape those things. And so, conservatives are deeply grateful for the institutions we have, which have, in practical terms, you look around the world, you say, okay, if I couldn't live here, where else would I want to live? And the answer is always, it's almost certainly going to be some other similar society. Not very many of us want to go and live in Nigeria or Malaysia or Inner Mongolia or Bolivia or Paraguay or something. Not to denigrate those societies, but they don't enjoy the great things that our societies have achieved. And that conservatives think that this is an incredible inheritance, and it hangs by a thread. That there are societies that came close to achieving this and then fell back. Argentina, classic example. Argentina was just as wealthy as Canada at the beginning of the 20th century. And now our standard of living is streets and streets ahead of them because they lost sight of the lesson human societies must learn if they want reliably to escape all these terrible things, the default condition of humanity. Progressives think that, oh no, the great things we have achieved are simply given. We will never lose these things. And in fact, not only are they just a given, but we can fiddle with them as much as we like. We can change everything we like about it is stable, and we can change anything we like about it, and things will only get better. This is why conservatives are not only grateful, but they're skeptical. Grand schemes for reform, all these ideas that, oh yes, we know everything about what has made us successful societies, and nothing we can do will damage what we have already achieved. We can only progress to ever greater things if only we will bring to bear our intelligence on the things we have inherited. After all, a lot of these things have simply grown up out of, no one designed them, back to the gardeners versus designers theme. No one designed them, but in fact, we could improve upon them if we simply said, hey, if we could get rid of this and start from the beginning, would we create? Of course, I think conservatives' view is that's exactly the problem, because you cannot go back to the beginning. Yeah, and you cannot get rid of things that have grown out of difficult, long-lasting experiments where we struggled to understand how to resolve these problems of poverty and disease and so on. We benefit from the experience of generations, which is embodied in our institution. And that's more knowledge and more experience than any bureaucrat with his laptop can ever hope to, thinking that he can or she can simply sweep away all these complicated old institutions and behaviors and experiences and will put in place something bright and shiny and new. Conservatives think, yeah, no, our experience has always been that when you sweep away the tried and true, the things that have actually worked in practice, regardless of whether they work in theory, who cares? Who cares whether they work in theory? The only thing that matters is, do they work in experience? And so when you sweep away what has been tried and true and certified by experience and replace it with some gaseous fantasy of an intellectual about how they would design things from the ground up, things always get worse. And there are these twin impulses of gratitude and respect for what we have inherited and skepticism about grand schemes for reform.
Brilliant. That is absolutely brilliant. And maybe I should explain, you already know this, Dr. Crowley, about me, but maybe for listeners don't realize this. Why would Watley care about the Army as a limited, not being a limited liability company? And of course, my background is in medicine, and I don't want to make this podcast about medicine. But in setting up my next question, the reason I struggle with these questions of government decisions having an impact on citizens is because of my direct experience within Medicare in Canada. And I spent quite a bit of time talking to some of the old timers who practiced pre-Medicare or even in the early days of Medicare in the early 1970s. And so to use a concrete example, we know that wait times didn't exist until the 1980s when governments were forced to cut back. Doctors would compete for patients since the middle of the 20th century up until into the late 1970s. Doctors, and I kid you not, they would not go on holidays if they knew their pregnant patient might deliver, because if their patient delivered when they were away, whoever was around to attend to that delivery would steal the mom and the baby and the whole family. Doctors did home calls. They had evening and weekend office hours. You just had to do that to be able to stay in practice as a physician. 30% of physicians' work in the 1970s was done for free. You just accepted that as a standard of doing practice. In the Depression years, it was as high as 50% work for free. This is one of the reasons doctors were big proponents of medical insurance throughout the mid-20th century. In fact, they established the largest medical insurance programs in Canada. Physician Services Incorporated, Associated Medical Services, up to 60% of the population already had medical insurance in the 1960s. So I offer all that as a concrete example of a institution, a social institution, medical care that existed, and it shaped the conduct, the behavior, the norms, the habits, the customs of the people working within the medical field. That was normal. All of that has changed over 50 years. The policy approach has shaped the underlying institution. I would say it has weakened the institution of medicine. But I wanted to get your opinion. We could have used other institutions, education, law, universities. What approach do we take now if we're looking at a set of policies that has really impacted an institution? But if we're of the mindset to say we've inherited something good, most people in Canada love their quote unquote free healthcare. We don't want to mess with that, but it is really harming the underlying institution of nursing or medicine, at least in my opinion. Now, some people think it's wonderful. I can work at just mornings if I want and still have a viable practice without caring too much about skipping my holidays for fear of losing patients. There's no shortage of patients. We have almost 6 million
There's
patients.
a shortage of doctors.
Yes, yeah, an artificial shortage.
Yeah.
So it seems to be there's a need for major change now. And how would you advise thinking about the situation that calls for major change?
We have some experience of major change. That was what the book Canadian Century was about, this incredible really program of reform that the entire Canadian political class undertook. Because I mentioned that we talk quite a lot about John Chrétien and Paul Martin as being the architects of the national federal level reforms, but part of the argument in the book is that it was in fact the entire political class in Canada. It was the NDP in Saskatchewan and the Tories in Alberta and Ontario and the Liberals in Ottawa, all of whom coalesced around a great problem that needed fixing. And they were extremely successful in doing so. And we learned, I think, quite a lot about how to do that successfully. For example, I think one of the lessons we learned was that people aren't actually interested in change driven by ideological consideration. They're Canadians, in my view, are very practical people. They don't care what the theoretical explanation is, but they really care if you damage the quality of their life. If you harm their kids can't see a doctor, or school isn't available to them, or whatever it is. Want to see that things are being done for the right reason. And ideology won't cut it for most people. They don't think that's a good reason. They want to see that politicians care about doing the right thing for people. And one of the reasons that it's so hard for us to reform the healthcare system, I think, is because we started healthcare reform from a very simple premise, which I think everybody, me included, completely agrees with, which is no one should be denied needed medical care on the basis of ability to pay. We're a civilized society. We don't let people go sick because they don't have enough money to pay for the treatment they need. Okay. I don't know anybody who disagrees with that principle. But the thing is that we have allowed the system to morph into something completely different, which is not, look, we're here to make sure that nobody is bankrupted by being sick. And we've turned it into is entitled to any healthcare service that isn't available to every other single person on the same condition. That's actually a completely different, in my view, highly ideological proposition. I can easily imagine the old system that you described, in which doctors were essentially entrepreneurs. They had to offer real services and real quality to their patients, or they would lose their patients to other doctors. I can see that system, which grew up again out of this long history of trial and error and adjusting the law around it and medical education, all these things. Nobody designed that system. No, it grew up out of the experience of patients and governments who helped to finance hospitals and things like that. And doctors and other medical professionals. Was there a small share of the population that was not well served by that system? Sure. I don't in any way contest that a lot of physicians provided healthcare services for no money. Okay. But there would always be people who would fall through the cracks. They wouldn't know a doctor, or they'd be intimidated. They wouldn't be sure that they would get the service for free. So that kept them away. Although that's perfectly legitimate concern. But once we replace that with this one-size-fits-all system whose job it is not to make sure that low-income people get the services they need, but to make sure that high-income people don't get services that they could pay for if they wanted them, which is a completely different. It became almost impossible to reform the system, because every time people said, the system needs to change, people said, oh, you want poor people to be without medical services. Actually, no, that's the part of the system we want to keep. But what you've done is destroyed all of the dynamics that made the old healthcare system such a powerful one that served the needs of people. And until we can find a way to talk to Canadians about the healthcare system in a way that brings their understanding back to this basic idea that, look, nothing that we will do will endanger the principle that no one should be denied needed healthcare services based on the ability to pay. That is sacrosanct. That will not be touched. But the way that we've gone about that actually has corrected in many ways the healthcare system. And we think we could bring back some of the old behaviors of the healthcare professions and so on, and improve the quality of the system. Until we can get to that conversation, I think we're stuck. I'm sorry about that, because I see the healthcare system declining all the time. Now, I will say if that's the circumstance in which we inhabit, then the only way to reform the system is through, I'm sorry to say, is through hypocrisy. We have to say we're doing one thing and do something else, right? We have to say, oh, we're preserving the principle of Medicare, but we're allowing private sector clinics to grow up so that there's some competition between providers and so on. And we have to get people to experience the alternative so that they say, oh, they're not. Part of the problem is that every time we talk about reform, what you have to do is you have to hold up some theoretical alternative versus the practical reality. And people say, I'm quite attached to the practical because at least I know that. And I know that it's supposed to look after everybody. And that's a principle we're all committed to. You have to get them used to dealing with private providers and so on, and discovering that actually it's not the end of the world. Good things happen. And then they say, oh yeah, just like in Saskatchewan with all these the experiments they've had with private clinics. And we ask people in the abstract, do you want to let private clinics in? And they say, no, it's a violation of Medicare. But you say, you've been to private clinic X. How was your experience? Oh, it was great. I really like that place. We're going to have to move by degrees, I think, until we reach some tipping point. And we're not there yet.
Yeah, thank you. So I've been fairly selfish with this podcast, just asking you the things that I care about and reading you quotes that I care about. And I should have asked you this earlier, but what questions or ideas, and perhaps you don't have time to share them in full, but what's keeping Dr. Crowley awake at night? What are the things that we should be asking that we're not asking right now in Canadian politics?
I worry so much that we have come to a pass where people who want to stand up and say the Canada that our forebears created and that we have inherited, we love that. We love that country. That means something. It made us who we are. And we think who we are is not a bad thing. We're back to this idea that only a handful of societies in the world have escaped those terrible default conditions of humanity, and we're one of them. I celebrate who Canada is and who Canada has become, and what we have to teach the world and what we have to hand on to the next generation. And yet I feel so strongly that governments in recent years have been actively putting about the idea that Canada is something to be ashamed of. We're somehow white supremacists, maniacs, slave owners, you name it. Every vice that you could discover in the history of humanity is somehow being attributed to Canada. And we're being told that there is no mainstream in Canada, that we're some kind of post-national state, and that's a good thing, that we're leaving behind the bad old Canada for this brave new world, which politicians in Ottawa are busy creating for us. And I have to say, I think this is a disastrous direction for the country. So that's one thing that's keeping me awake. The other thing that's keeping me awake is what I think of as the terrible and shocking deterioration of relations between Canada and the United States. We are, I've talked a lot about Canada and what it has brought to the world, what the things we have to be proud of. And one of the things that has contributed to us being a unique and valuable member of the international communities. We are a new world society like the United States. We're not disfigured by many of the old institutions that characterize places like Europe and the old societies of Asia that are hierarchical and aristocratic and anti-democratic and authoritarian and all these other things. None of that is our tradition. In fact, both our countries have been populated largely by people who left those countries because they wanted freedom. They wanted the freedom to be themselves. They wanted the freedom to be responsible for themselves, to create their own life out of their own efforts. And I think Canada and the United States, as a result, even though we broke over issues of loyalty to the crown and all sorts of things, actually that's an icing on a very deep cake. Right? And we have fraternal ties. And it's not just because we speak a common language and we share a continent, but it's because we share certain assumptions, which I think I'm not ashamed to say these are the assumptions of English liberalism: freedom, responsibility for self, private property, non-corrupt institutions, law and order, all of these things. And if we allow tiny differences over things that, in my view, are fairly easily adjusted, trade disputes and things like that, if we allow those to undermine the close relationship we have properly enjoyed with our American friends, it won't just harm our prosperity. It will do that. There's no doubt about it. But it will shrink Canada's world. Our partnership with the United States has been, I think, one of the great blessings of Canadian life. It has expanded our horizons. It has given us access to knowledge and technology and managerial skills and inspiration and energy and markets and all kinds of other things, which we simply will not be able to replace anywhere else. And I think this business of booing each other's national anthem at hockey games, and so we stand, in my view, at risk of damaging a relationship which has lasted for centuries and which has redounded to the benefit of people on both sides of the border over cheap nationalist point scoring, which I think we will all come to regret. And I think it is more than necessary for those of us who see the value in that close, constructive relationship between our two countries to be speaking up and looking for ways to revive that relationship. Because if we don't, we're going to allow our emotion to destroy something which is of inestimable value to people on both sides of the border.
Yeah, said. What a way to end, for sure. I have to encourage listeners again to go out, buy the books. I'll put the links in the show notes. Check out the Macdonald Laurier Institute. Check out the Center for North American Prosperity and Security. We didn't even get to discussing that. Click the subscribe button on the bottom corner of your screen so that you'll be alerted for new content, but also subscribers help the show. Dr. Crowley, I hope we can have you back again sometime, and I hope you start 3 more think tanks in Canada over the next 10 years. You're a serial think tank creator and shaper of public policy, so thank you for all that you do.
Thanks for what you do, Shawn, and thanks for doing me the great honor of having me on your podcast.
My pleasure.